So, all right, if we invented primary care all over again, if we reinvented it, what would that look like? Welcome to the Wisdom of the Body podcast. I'm your host, Heather Grzych. Here, we talk about the profound connection between mind, body, and spirit. Join me and other authors, wellness experts, and everyday individuals talk about the importance of listening to our bodies, trusting our guts, and living in deeper harmony with nature. So, whether you're seeking guidance on your wellness journey or simply looking for inspiration, you're in the right place. We're thrilled to be in the top 3% of podcasts globally. You can find the Wisdom of the Body podcast on Apple, Spotify, and most other places where people listen to podcasts. You can follow by joining my email list at heathergrzych.com or by following me on Instagram at Heather Grzych. That's Heather, Grzych. I know you're going to love this podcast, so take a second right now to subscribe. Welcome back to the Wisdom of the Body, and we're going to talk today about reinventing primary care. A lot of people really are frustrated with the healthcare system, at least in the country where I live, in the US. We need to talk about this because there's definitely a lot that we could do to improve it. And I want to talk about this from a different angle than what you might assume, because when people think of primary care, they think of, going into your doctor's office, getting your vaccinations, kind of a whole set of services that they're used to getting, maybe getting an annual physical, getting their blood work run, things like that. And that system that we have for primary care is influenced by the larger healthcare system. So it's influenced by insurance companies, it's influenced by hospital systems, it's influenced by policy debates. But I want to talk about it from the lens of Ayurveda, because Ayurveda is also a system of primary care. And I think there's a huge opportunity. I think some of the other complementary medicines are providing different types of primary care than the mainstream system is providing, though they're not often called primary care. But if you've ever sat in your doctor's office and waited 30 minutes to be seen for 10 minutes, then you might be wondering, is this really the best we could do? Or if you've ever felt rushed or unseen or treated like a set of symptoms or treated like a car with parts that a mechanic is throwing around and not being very sensitive to, then you're not alone, because a lot of people feel that way. We are really good in our healthcare system in the United States at treating disease, but we're not really good at treating people. And we can probably change that. Now, I also know that some of you listening are probably also healthcare professionals, and I know you're frustrated too, because a lot of people are frustrated with the healthcare system, but the healthcare providers actually feel limited by the system that they serve in. There's certain guidelines they have to follow and caseloads and things like that that actually make providing good care a challenge for everybody. But we can dream and we can hope for a better future. So why don't we do that? Yeah. Primary care, first, let's just start with that. What's it supposed to be? It's your first point of contact. In traditional, it's the doctor who, I had a doctor, a pediatrician that I would go to. It was my doctor that I went to, delivered me as a baby, saw me every year for my physicals, saw me when I got sick, had a very strong relationship with that particular pediatrician. And then as you get older and you start to enter into different specialties of medicine, or, women will get a OB/GYN when they start, having a period or becoming sexually active or whatever it is that initiating event is. But our healthcare becomes a little bit more dispersed, and we see somebody for our physical body and we see somebody else for our mental problems and our mental body. And it's not all really tied together the way it is in Ayurvedic medicine. If you talk to most patients and even the doctors, you'll hear a lot of people say that primary care has become very transactional. It's like a quick intake, a checklist, a prescription, maybe some labs, and bye-bye. I think some doctors are really good at the softer skills that make for a little bit of a deeper experience. But nowhere is there anything about the behaviors that lead to health that's happening in the doctor's office in that primary care visit. That's outsourced to nutritionists and people like that, and very rarely utilized. So, in a regular visit today, there's barely enough time to breathe, let alone talk about somebody's digestion or their sleep or their mood or their purpose in life. And these are the things that will influence your health. These are the things that actually create health, how you're doing in these areas. And a lot of the doctors are burned out. And frankly, it takes a long time to get some of that information, to sit and to ask those questions. It takes a long time. And the doctors are not able to do that in the short visits that they have. But they went into medicine because they wanted to heal people. And a lot of them just end up managing software and insurance codes and relying on machines to determine what is going on with someone. And this is going to get even probably more pronounced in the healthcare system as people are relying on AI more. So we've built this healthcare machine that's really good at fixing broken parts, but it's not good at keeping that organism whole. And that's really where the area of opportunity is in primary care. So coming from my experience as an Ayurvedic practitioner, there is primary and specialty care. There are branches of specialty in India because it's a very well-established system there. In the US, it's different because we don't have as established of a system. So most of us operate more on that level of general health and wellness for people. But a whole person is mind, body, spirit, and environment. And we're all moving through cycles of time, through nature, through change, through seasons, and all these things affect us differently. So in Ayurveda, the goal is not to treat a disease, but to protect the health of the individual, that healthy essence of the individual. So there's this Sanskrit phrase, which is swasthya rakshanam. And that is to protect the health of the healthy. So if that were the purpose of our healthcare system, our larger healthcare system, not to treat illness, but to protect wellness, I wonder what we would be doing differently. In the Ayurvedic approach, the experience tends to feel less clinical. You go into a space. I work mostly virtually with people, but when I did have a space, it was always like in a yoga studio. It did not look like a clinic. It looked like a spa. It looked like an acupuncturist's office, and creating a space where someone can talk about things and you form a relationship with someone. And it's not just about asking like what's wrong with somebody. It's about like, who are you? Who is this person? What's happening in your life right now? What is leading to you feeling this way? And where can we go from here? So in Ayurveda, we want to know how you eat, how you sleep, and how you work. We also want to know how you love, what kind of relationships you have with people in your life, because all this matters. All of this is in your field, and all of these things from a sensory perspective are affecting you. They're affecting your mind, the experiences as well, but everything in your environment is affecting you from a sensory perspective. And when we look at changing things for a person, we don't use medications in Ayurvedic practice. That's not part of our scope of practice, but we can utilize supplements and herbal medicines, foods, mainly treating this on the level of food and things that you ingest in your diet so that you can align your lifestyle with nature and learn how to listen to your body's rhythms. So, all right, if we invented primary care all over again, if we reinvented it, what would that look like? So let's picture this. You walk into a space, it feels very grounding. It's got natural light. Maybe there are some plants. Maybe there's some kind of tea brewing. Someone greets you by a name. Maybe there's no smell at all because, some of us are very sensitive to smells, aren't we? But the first part of your visit isn't like a blood pressure cuff. It's a conversation. And you talk about what's changing for you, what's happening now and what has changed. So in your digestion, your energy, your emotions, your physical manifestation of your tissues, what's happening in those. Like, is there an eruption in the skin? Is the hair falling out? Have we put on some weight? Just examples of how the tissues might be changing. Are you dry? Are you more wet? Are you more inflamed? So the other thing we would do is a pulse reading in a visit in person and look at your tongue, and definitely have a lot of discussion around your day-to-day behaviors, cravings. And in the process of these questions, you're going to be asked questions of things that you probably haven't even thought of, or maybe you just didn't think were very important, but it brings your awareness onto what you're doing to yourself more, and also how the environment is affecting you. Because in Ayurveda, the patient is not passive. You're an active participating person in your health. And that's kind of different in modern medicine because doctors are trained at a level that's so far from where a normal person knows about their body, right? So the level of understanding of how a human body works between the average patient and the average doctor is a huge chasm. So there's a power imbalance in that relationship. And in Ayurveda, yes, there's a certain type of education that happens in Ayurveda, but the people who tend to gravitate toward it are also yogis and people that have develop some sort of self-awareness so that they can be in conversation about what's happening with them, that they've looked at things and they have the data points to be able to say, oh yeah, actually, like, my period blood kind of looked like this last time. Or, yeah, I noticed that after I eat this, this happens. Or I noticed that after I eat this kind of food, that this feels this way. So there's a lot more awareness happening of what's going on inside a person in that setting. And because of that, you can honor that natural sequence of healing. You can make changes that will lead to gradual resolution of things, not necessarily just take a pill that's supposed to fix the thing and then keep doing the behaviors that are causing the issue in the first place. That's not what we want. So here's the deal though. If you are bleeding or you have an infection, okay, you're not going to want to go to your Ayurvedic person. You're going to want to go to your doctor. You want to go to an urgent care facility. But for daily maintenance, wellness focus, so digestion, sleep, fertility, focus, mood, aging, things like that, we need something else. We need a system that reminds people how to live well and not just how to survive. Now, you might be thinking, that sounds lovely, but how are we going to pay for this? Because most of us will go to the doctor that is covered by our health insurance, because that's how our system is set up. And that's really the deeper reinvention of the system, not just how we deliver care, but how we define value. Because our current model is built around disease. It only makes money when people are sick. And it's a business that depends on you being sick. It's a business that depends on breakdowns. Now, frankly, as an Ayurvedic practitioner, I kind of depend on it too, because most people aren't going to go see somebody unless they aren't feeling like 100% well. Now, you do have some really extremely proactive people who are at the smallest, slightest little thing. They not only do they want to understand what's happening with them now, they really want to learn, okay, what can I do to prevent this or other things from happening in the future? So there is a little bit of a different mindset with wellness stuff, but no one takes any action unless there's a problem. And maybe, I know some people have experimented with this in the current medical system about, outcomes-based care and things like that. Perhaps that's something to look at. In some countries, the medical professionals all work for the government and they're just paid as an employee of the government. So delivering care in a way that incentivizes sickness, though, is something that we really need to look at. So why don't doctors recommend fasting when fasting could change the health of so many metabolic issues? It's a huge problem. So the reason they don't recommend fasting is first of all, they probably don't think a lot of people will do it. And they probably have no way to check on whether the person is doing it. And there's no pharmaceutical that that person can take, that pharmaceutical company can get paid for. And it's just less controllable fasting because it requires you to do something at home rather than depending on something, a physical object that the medical provider is recommending you do. But Ayurveda reminds us that so much healing happens outside the clinic, in the kitchen, in your relationships, in your yoga class, in your exercise class, hiking in the woods, in rhythm, in awareness. So maybe reinventing primary care starts with reclaiming that power, remembering that care doesn't begin with a doctor's visit, that care begins with what you're doing for yourself at home. So reinvention is not just about patients, it's also about the practitioners. What kind of different experience do they need to have in this system? Because we need to embody the kind of care that we want to create. And we need to slow down enough to truly listen. So in Ayurveda, the practitioner is a mechanic. Like, we're not going to fix anything. We're more of a mirror. We're more of a way, we're providing a lens to see things through. And actually, in some ways, the experience is a little bit more like seeing a psychotherapist than it is seeing a doctor, because there's a lot of conversation around, there's a lot of questioning, there's a lot of self-reflection that happens in an Ayurvedic consultation. So there's this power that's based not on authority, but there's a power that's based on presence, connecting, finding out information, being a mirror, seeing things, noticing things about your body, your life, your physical state, the things that you're doing and how they're affecting you, and then the way that the environment is affecting you as well. And there's not this effort to fix it all with a pill, but to understand the larger system at play. And we need to figure out how to make modern healthcare feel like that, not just function like that, but to feel like that, because that's really how we're going to heal that system. When I first started studying Ayurveda, I was amazed by how simple and profound it was. Didn't need a machine or fancy labs to tell me what was off. Just asked me to pay attention to my physical sensations, my emotional body, my thoughts, my mental state. Look at my tongue in the morning. Look at my energy after eating. Look at my emotions during different seasons, when I'm around certain people, at certain times of the month. Listen to my dreams. Look at my dreams. And it reminded me that my body is not something to control, that it's something to actually listen to. And the more I listen, the more I realize how much of life and things in life and society had trained me to not trust myself, to wait until something broke before I sought help, and to not really even try to understand when a problem happened, how it got created, and how I could prevent it in the future. But Ayurveda instead has said, like, what if you could catch imbalance before it becomes a disease? What if you could prevent crisis by tuning in daily, really reading your body? Later, I also learned how to read blood work. That was definitely a useful thing. And that is super helpful to understand what's happening biochemically, to speak the language of modern medicine. And I started partnering with doctors who could run labs for me. There's a couple companies that do that, and they can run them for me or they can run them for my clients. And we can integrate both perspectives, because the subtle signs that Ayurveda reveals and the measurable markers that the diagnostics capture is amazing to have both of those. And this partnership feels like kind of an evolution, like two worlds remembering that they belong to the same body. And I hope to see more of that in the future, because Ayurveda will help you feel imbalance before it shows up on a lab. And Western medicine or modern medicine is going to help you measure it really clearly once it does. And together, they create a more complete picture. That's the kind of primary care I want for the future, where we don't wait for sickness to validate care, where health isn't just this absence of disease, but the presence of vitality of a person. There's a definition in Ayurveda where it's like the person rests in herself or himself. You rest in yourself. So how do we start reinventing primary care right now? Well, one, you got to bring the body back into the conversation. Don't ask just what's wrong, or ask a better question like, what's changing? And the second thing would be to build relationships, not transactions, because continuity will build trust. And it's that trust that really heals, like that a person could get to know their provider, but also in that process get to know themselves better. Because at the end of the day, I think what each person really wants in their health is they want to know that they know what to do in order to be healthy, that they trust themselves to be healthy, that when they get sick, it's not this mystery about why it happened, that they feel like they have something that they could do to influence this. So the third thing is to shift the focus to prevention. Your daily habits, sleep, eat, move, breathe. These are just super powerful medicine. So come back to the basics on that. The fourth thing I would say is to use the senses. My son loves these blood pressure cuffs when you go in the doctor's office. And I think that it's a really important tool, a blood pressure monitor. Yeah. But also the senses are a very important tool. We need to use not just the machines to learn what's happening inside of a person's body, but we also need to use the five senses involved in that process. So hearing and sight and touch and taste and smell. There's a lot you can tell about what's happening with a person just with the five senses. And everybody needs to keep that cultivated, because if we give up all of our power to the machines, what are we going to be able to do when we don't have the machines in a certain situation? So we need to keep our sensory awareness in medicine preserved for sure. And the fifth thing I would say is to become your own primary care provider, every person. Like primary care is with you, that you are the first line of awareness. You notice before anyone else, and you really honor that. Like you have to be the primary care provider for yourself. Then figure out, who is it that's that next bridge for you to be in conversation for your health from there. So what I would love to do is to envision the primary care of the future with you through meditation. So if you're in a place where you can pause, close your eyes for a moment. If you can't close your eyes because you're driving or something like that, please don't do this. But if you can, close your eyes. Let's imagine together the primary care of the future. Take a deep breath in and exhale slowly. Now picture yourself walking into a space of care. Now take a deep breath and imagine the future of primary care. What does that space feel like? Is it warm? Is it cool? Is it calm? Is it energizing? What does it feel like? And there are pleasant scents in the air, no scents at all. It's a welcoming environment with natural things in the environment, perhaps plants, sunlight. The first thing you see is something beautiful, natural, that connects you to your humanity. You're greeted by your name and greeted as a whole person. You get eye contact. You sit together with your practitioner, your provider. You talk. You talk not just about symptoms, talk about your sleep, you talk about your dreams, you talk about your belly, your relationships, your purpose, your emotions. Your practitioner touches you on your pulse, on your wrist. Your practitioner looks into your eyes, feels your skin, touches any places on you that you're concerned about, that you want that person to look at and help you understand. And maybe this person also orders labs for you, blending this ancient intuition with that modern precision. And you talk about what you love, what you don't love. You talk about what you ingest, what you crave, and you leave not with a prescription to fill, but you leave with a plan to feel more alive. And in this future, perhaps you're utilizing different foods as medicine. You're understanding if there are foods that are leading to any of the issues you might be experiencing. You understand how everything you're putting in your body is affecting you, whether that's something that comes in through your mouth or into your other senses. And through this experience, you become more aligned, that you remember that there's a wisdom that has always lived inside the body. And even though it's hard to explain exactly what that is or geolocate it, you understand that it's there. So take one last breath in and exhale with gratitude. First, for the care that is already possible, the kind of care that begins with you listening to your own body. Take another breath in and exhale with the gratitude for the future of your care, to know that we can do things better and that it's not that hard, and we will figure out how to do it. Take another breath in and a breath out on your own, nice and slow. If your eyes are closed, go ahead and slowly open your eyes. And that future, it's beginning now, right here with us. Let's figure out how to do this thing better. If we reinvent primary care, maybe we bring in more whole health providers. Maybe it's about more integrative medicine. I don't know exactly how we're going to get there. It's not about replacing doctors. It's about remembering everybody in the system, remembering the art of care, remembering their connection to nature, care that is personal, that is rhythmic, that honors both science and the soul. Because the wisdom of your body is ancient and it knows how to heal. It needs space and time and a system that believes in that too. And I'm not saying if there's a tumor in the arm, you don't cut it out. I'm not saying that, everything's all rosy in holistic healthcare land. It can't solve every problem. We need everybody in this system. So maybe reinventing primary care isn't about more technology or more data or more apps. And maybe some of those things really are going to help people. We shall see. Maybe it's also about coming back to something timeless, something wise, something human. Thanks so much for listening to The Wisdom of the Body. Thank you for tuning in and dropping in with us today. Don't forget to subscribe, rate, and review this podcast. I really want to hear your feedback. To learn more about my work, visit heathergrzych.com. That's Heather, GRZYCH.com. And meet me here next time on The Wisdom of the Body.